Okay, so welcome everybody to our webinar today, where we'll be talking about the intersection of gambling and the cost of living crisis. Obviously, over the last few months, we've all been hugely impacted by cost of living issues, particularly in our work lives. I know for many of the organisations represented here today, you'll have been tracking this closely in terms of how it's impacting your clients or your customers. Certainly here at GamCare, it's something that we're hearing about more on the National Gambling Helpline and in our treatment services, and that's a concern for us. And for that reason, really, we decided to explore this further, and we're delighted to have worked with YouGov to do this. We first did a survey last June to explore these issues, and we thought it'd be timely now to revisit those after Christmas and after things have moved on a little. So, in terms of the format for today, we have got two 20-minute or so presentations, and then we've got about 15 minutes at the end for a Q&A. So throughout the webinar, you can submit questions using the Q&A button at the bottom of your screen. And just so you all know, we're recording today as well. So I'm delighted to be joined by Kate Goschalk from YouGov, who's a research manager, and she's worked extensively around both cost of living and gambling issues. I'm also joined by Kathy Wade, who's the manager of our money guidance service here at GamCare, which was launched in the last week or so and is available via the helpline, and she'll be sharing some insights from that. And then during the Q&A session, I'll also be joined by Helen Gudge from our National Gambling Helpline. She's one of our most experienced advisors, and she'll be able to share some insights from what we're hearing on the line. So, first of all, we're going to have the two presentations, and I'm going to hand over to Kate, first of all, from YouGov, who's going to take you through the data and insights that they've gathered around gambling and the cost of living crisis. Over to you, Kate.
Thank you, Anna. I'll share my screen, so let me know if everyone can see this okay. Cool. So as Anna said, my name's Kate and I'm research manager at YouGov. I work in our public sector and charities team, so kind of working across a huge range of public sector clients and lots of charities, but more specifically kind of focus on healthcare, addiction, and then have a real focus in my role on kind of gambling related harms, which has been quite a core part of my role for the past 5 years now. And as a part of this, I've led the current survey for GamCare, which is on gambling and the cost of living, which, as Anna said, kind of follows on from the 2022 State of the Nation piece we did. But this year kind of became a bit more of an extensive survey, kind of looking at some of the challenges people are facing at current times, and then thinking about how those issues kind of specifically affect people who gamble. So throughout the research, we've kind of focused on 3 key audiences, which you'll kind of see as we go through the webinar. So this is the general public, so kind of anyone in the general public, which we kind of often use as our comparison point. And then we've also got our PGSI 1+ and PGSI 8+ gamblers. And so for anyone unfamiliar with the term PGSI, it stands for the Problem Gambling Severity Index, and it's a very well used way of kind of measuring how much harm someone might be experiencing from their gambling. So anyone with a score of 1+ is kind of defined as anyone who's experiencing some harm from their gambling, and then anyone with a score of 8 or more are kind of typically called, using the PGSI method, problem gamblers, but we kind of tend to refer to them as 8+. But that's kind of those at kind of most risk of harm from their gambling. And that's kind of calculated by asking people a number of different statements. So for example, whether they've ever bet more than they can afford to lose, if they've kind of experienced anxiety or depression from their gambling. And that's kind of how we tend to group people who gamble. And then just a bit on the method itself. So we conducted the survey on our own YouGov panel, and we surveyed around 4,000 people, both this time and also in 2022. And we conducted the research at the start of the year, so towards the end of February. And then we sampled and weighted the data to make sure that we could say it was representative of the whole of the UK by a number of different demographic factors. And so in terms of what I'll take you through today, we've obviously collected a lot of data over a 2-year period. So we're going to try and focus on some of the more topical aspects. So we'll kind of start by setting the scene. So thinking a bit about what concerns people who gamble have, how's that kind of changed year on year, and then kind of moving to look at some more specific actions or experiences that people might have had. And then finally thinking about what impact the cost of living will have on the gambling landscape. So do people kind of see themselves gambling more or less, or are they kind of thinking that it might stay about the same? And then, as Anna said, we'll kind of move on to questions at the end. So if you do want to kind of chat anything through, or you think anything kind of particularly stands out, we can get onto that in the Q&A. So starting really by setting the scene, we asked a couple of questions surrounding people's financial situations. So firstly, we asked people how worried they felt about their own financial situation. And on the chart, you can see that we've got the 2022 and 2023 data here. And you can see that among the general public overall, around half say that they're concerned about their financial situation currently. So that's either people who say they're very concerned or fairly concerned. And this does rise slightly as we go up the PGSI scale. So among our 1+ gamblers, and that's anyone who's kind of experiencing some harm from their gambling, that rises to 59% saying they're worried. And then among our 8+ gamblers, 57%. So slightly higher, but actually not drastically so, compared to some of the other findings we'll see later, where we are kind of seeing real differences between, say, the general public and those most at risk of gambling harm. But what I think is interesting here is we are kind of seeing an increase in concern across the board. So among the general public, that's relatively small, only a 5 percentage point difference. But when we get to our kind of 1+ gamblers, that increases slightly, and then our 8+ gamblers, that's where we're really kind of starting to see that people are feeling more concerned than they were this time last year. So rising from 45% of this group to 57% of this group. And if we look at what's driving that, it tends to stem from a number of different demographics. So I think starting by looking at income, you can see that actually it's those in the slightly higher comparative to kind of the lowest income bracket. It's those in those brackets where they're kind of starting to see increased concern now. So we can see that, for example, among those in the highest income bracket, so £60,000 per year, that's gone up from 38% to 54%. And note that this is kind of looking at gamblers who are experiencing some harm. And I think what's interesting here is we're not actually seeing such a big difference when we're kind of looking at those in the lower income bracket. I mean, I guess we could hypothesize here that maybe this group already kind of had quite high levels of concern. It's kind of something that isn't necessarily new to them, and they might already kind of have ways of managing their money in place, such as kind of using shopping vouchers, kind of reducing energy costs and things like that. But it does kind of show now that among our 1+ gamblers anyway, concern is kind of starting to level off. So the picture here is quite different to what we were seeing this time last year. And then looking at this by gender and age, it's really men and those in the younger and middle age groups who are kind of driving this increase. And I think why this is interesting is gamblers who kind of tend to be experiencing kind of higher harms from their gambling, engaging more risky behaviours, tend to be exactly these people, so men and specifically young men. So I think that's definitely kind of something to bear in mind as we kind of move into the other questions on kind of how people are feeling. So in this year, we also included a new question on how worried people were about losing their jobs specifically. And I think what really stands out to me here is whilst when we asked people about their financial situation more generally, we saw kind of minimal differences, so slightly higher among gamblers, but not so much so. When we're kind of looking at how worried people are about losing their job, we're seeing completely different pictures for the general public and those affected by gambling harm. So thinking about people who work in either full or part-time jobs, a quarter of the general public say that they're worried about losing their job currently, which rises to 35% of those experiencing any harm from their gambling, so 1+, and then half of those experiencing high levels of harm from their gambling. And I think why this is so important is it really kind of highlights the difficult financial position that people are in. We know from other research that reasons for gambling include being stressed, kind of everything that might come with having worries about losing your job, but also lots of people do gamble as an income source. They kind of see it as something which might improve their financial situation, even though there's kind of a lot of instability that comes with that. So I think this is kind of really important for positioning how people are feeling at the moment. People are concerned, they are worried. And I think then it's kind of thinking, what impact could this have on gambling? And could it kind of push people to engage in more risky behaviours, for example? And again, we can cut this by different demographics. So among our 1+ gamblers who are currently in work, we can see that it's those on predominantly lower incomes who are more worried about losing their job, and also parents. So I think this kind of is a theme that we see coming out of the research more generally, but those with care responsibilities tend to show higher levels of concern because it's not just about them, they're kind of also providing for a family, say, and so if they lose their job, that kind of has a knock-on impact on other people. Here we're not kind of seeing standout differences by gender, so very similar percentages for both men and women, and then by age it tends to be those in the middle age group, also slightly higher among our youngest age group, though there's less of a concern among those age 55+, I guess, who might be coming towards the end of their careers or kind of have some money set aside there. And so I think this kind of data is really important for just kind of positioning where people are, and people are kind of feeling concerned, and it's really about thinking what are the next steps for people then, and what might that kind of push people into doing. And so then the next section, I guess, digs a bit deeper into how people are coping financially. So it's worth noting, it's often quite interesting to look at something like worry as a kind of more general theme, but it might be that kind of people can sometimes overstate how worried they are about something without necessarily knowing like what actions they're actually taking or what their specific concerns are. So this will kind of dig a little bit deeper into that. But firstly, on the same theme, just looking at how comfortable or uncomfortable people are kind of feeling financially. So we showed people a scale question where at one end we had whether people can't afford essentials and they often go without things like food or heating. And then at the other end, we've got people who say they're very comfortable financially, which tends to be a much smaller proportion. But as we can see here, as PJ size score increases, so as people are kind of increasing the amount of harm they're experiencing from their gambling, there are much higher numbers of those who kind of fall into this can't afford essentials group. So among the general public overall, we've got 5% falling into that. So that's the kind of dark purple bar here, which rises to 11% of our 1+ gamblers, and then 17% of our PGSI 8+ gamblers. And again, looking at the second category as well, so people who can only just afford essentials, but often struggle to make ends meet, 18% of the general public, which then rises to 34% of our PGSI 8+ gamblers. And there could be kind of a range of socio-demographic factors which play into this. So for example, we know that PGSI 8+ gamblers tend to be younger, they tend to be on lower incomes, more likely to be from ethnic minority backgrounds. But it does suggest that this is a group which kind of need to be prioritised and I guess kind of thought about slightly differently to the general public. And then I mentioned earlier that parents, we kind of saw some patterns coming out among them. Obviously, this is a group who kind of have additional care and responsibilities. And this year, we kind of included some new questions on, I guess, kind of actions people have taken in the last 12 months, which might relate to kind of giving things up or show how they might be struggling financially in various ways. So we asked parents whether they'd ever struggled to afford school uniform, school trips, sports or additional activities, and then also whether they'd gone without something essential. So that could have been anything from food to kind of toiletries, but to afford something for their children specifically. And again, we're kind of seeing those very stark differences between groups that we saw when we looked at, for example, how worried people were about losing their job. So for example, I think taking this one, so whether people have gone without something essential, we can see that 1 in 5 of parents in the general public say they've done this, but that rises to half of our 8+ gamblers group. And again, we're seeing very similar patterns for these other statements. So for example, 20% of those who struggle to afford school trips, sports or additional activities, so 20% of the general public say that, versus 53% of our 8+ gamblers. And then looking at who this is specifically, it tends to be people who are on lower incomes, those who are never married, those in the youngest age bracket, and also ethnic minorities. And I think here it's also worth just mentioning that there is a lot of overlap between these groups. So for example, ethnic minorities in our sample kind of tended to be much younger and also never married, but it does kind of suggest that for people who might be caring for a child, have kind of additional responsibilities that doesn't have another income source, I guess in the case of those who might not be married, there is quite a big strain. And I think just thinking about the figures more specifically, we saw that half of 8+ gamblers said they'd gone without something essential to afford something for their children. And this data is actually looking at anyone who's gambled. But if we did kind of have a larger base size and could look at 8+ gamblers specifically, it might be that these stats were much higher. So it's likely that even more people would be kind of saying that they've had to go without things for their children. And then finally in this section, looking a bit more specifically at the actions people have taken in the past 12 months, which I guess kind of goes beyond just thinking about how worried people are, but it's what have people actually done. And this data is kind of comparing our P-decile 8+ gamblers, so those most at risk from gambling harms, to non-gamblers. And you can see here that 8+ gamblers are more likely than non-gamblers to have done every single one of the things on this slide. So that kind of ranges from things such as borrowing money from family and friends, struggling to pay for groceries, or kind of seeking advice from something like citizens advice, but also things such as going to public places to avoid paying to heating, using a warm bank, and taking out a payday loan. And I think it really struck me just how big some of these differences were, and the fact that it was kind of across the board. There weren't any of these statements where we kind of saw a reverse in this pattern. And then just looking at this any figure as well, I think that kind of really highlights this. So 8+ gamblers, 84%, so the vast majority have done one of these things, compared to just a quarter of our non-gamblers. And I think as well, something to kind of bear in mind here is some of these activities are also things which can kind of lead to debt. So for example, 8% of 8+ gamblers having taken out a payday loan or borrowed money off family and friends, whilst these might be kind of positive in current times, it can obviously have a knock-on impact kind of later on when people need to pay this money back. So I think quite an important slide in kind of contextualizing some of the differences that different groups face. I know that GamCare have kind of shown a lot of these stats on social media and the website, etc., more recently. And then we'll now look more specifically at the impact of cost of living on gambling. So I guess the initial kind of part of this was kind of setting the scene about how people are feeling, but what will actually happen kind of looking forwards. And it's worth mentioning here that this is kind of based on people's expected behaviour. So we're kind of asking to people to predict how they'll behave. Really, you'd kind of need more research at various points to see how that actually changed. But we started by asking people whether they think they'll gamble more, less, or about the same as they currently do as a result of the cost of living crisis in the next 12 months. And what's really interesting here is as we kind of go up the PGSI scale, we're seeing completely different pictures among different groups. So thinking first about our kind of PGSI 0 category. So this is people who gamble but aren't necessarily experiencing harm from it. So it might be that someone's kind of doing the lottery every now and then, but that's it. They're not kind of engaging in other gambling activities and kind of not engaging in some of the risky gambling activities. But among this group, the vast majority think it will stay the same. They don't think that the cost of living crisis will have an impact on their gambling. A quarter actually think they'll gamble less, which could be due to kind of wanting to save money or people kind of giving up certain activities more generally. And then it's really when we get to the 3 to 7 group, so this group is typically called our moderate risk gamblers, that we're starting to see a more sizable proportion that say that they think they might gamble more. So it's still less than the proportion thinking they'll gamble less or about the same. We can see that 18% of this group think that it could spur them to gamble more. And then actually looking at our 8+ gamblers, so those most at risk, 2 in 5 think that they'll gamble more as a result of the cost of living crisis. And that is actually higher than the individual proportions thinking they'll gamble about the same amount or less. And it's worth mentioning here that it can be quite tricky to measure something like this. So at the start of the COVID pandemic, we worked on a longitudinal study with GambleAware, and we kind of looked at whether people were gambling more or less during COVID. I think given especially there were so many hypotheses, like would people be gambling more because they'd be at home, bored, potentially stressed, or would people gamble less because football matches are being cancelled, bookmakers were shut, etc. And actually, whilst there were probably some kind of below the surface changes, what we saw in the data was pretty high stability. So there wasn't a huge change in the types of activities that people were doing, and there wasn't a huge change in participation overall. But I think the reason for that is often when you're kind of looking at the overall figure, it kind of masks the fact that some people are gambling more and some people are gambling less. So that has that kind of net balanced effect at times. And also thinking about gamblers more specifically, the 8+ group is a relatively small proportion of our gamblers overall. However, that doesn't take away from the fact that 2 in 5 do think they'll be gambling more. So it's really kind of making sure that there is kind of measures in place to kind of guide people, and then also thinking a bit about the reasons for this and what messaging kind of might be most effective, which we'll kind of move on to very shortly. And very quickly, just to kind of touch on some of the demographics here, thinking about our 1+ gamblers, it tends to be parents, men, those in the younger age bracket and ethnic minorities who think that they will be gambling more as a result of the cost of living crisis. And those groups specifically are groups who kind of tend to be more likely to be engaging in some of the more risky gambling behaviours. And then these 2 final slides, I think, do a good job at kind of explaining the reasons or potential reasons for this. So we also ask people whether they think that gambling will improve or worsen their financial situation, or whether they think it will stay about the same. And I think what's really interesting here is we're pretty much seeing the exact same figures or the exact same patterns as we saw 2 slides ago. So those with lower PHSI scores are more likely to think that it won't really have an impact on the financial situation, which again makes sense given they might not necessarily be gambling that much. But among our 8+ gamblers, 2 in 5, so the same proportion, think that gambling will improve their financial situation. And that's actually more so than the proportion who think that it will worsen their situation. I think that kind of explains it really. People think they might gamble more because they think it's kind of a money-making opportunity. So they're kind of seeing it in that sense. And I think it kind of really just highlights the need for messaging around the instability of gambling as a source of income, especially in current times. Many of these people will be winning money off gambling, but also, as we know from kind of lots of the research we've done, it can be very cyclical. People might win big and then kind of lose money and then end up chasing their losses. So it kind of really suggests the need for messaging around the instability and kind of measures in place to support people. And then just looking at this by demographics, again, it's the kind of same key groups coming through. So then just to wrap up, and I won't kind of take you through all of these points, I think the main takeouts that I've kind of got from this research are everyone is kind of struggling at current times, but in particular it is people who gamble, and specifically those who gamble at the most harmful levels. This has kind of led to half of workers in the 8+ category saying that they're worried about losing their job. And we know from kind of other research we've done that when people are kind of struggling financially, stressed, feeling anxious, it can kind of prompt them to engage in risky behaviours. We've also got 2 in 5 saying they think they will gamble more, and the same proportion thinking that this could be kind of due to gambling improving their financial situation. So some people kind of seeing it as a way to improve their finances over what is quite a difficult period. So it really just highlights that need for meshing around instability, and I guess also going forward, just thinking about the use of research to kind of monitor this, say 6 months or 12 months on. Great, so that's everything from me. If you do have any questions, we can kind of pick them up in the Q&A, and also do feel free to get in touch with me directly if anything else crops up after.
Okay, thanks very much, Kate. It's incredibly interesting research, quite stark findings in some places. We're starting to get some questions through, so if anyone does want to ask anything in the panel session at the end, please do pop your questions in the Q&A. In the meantime, we're going to go straight over to Kathy now, who's the manager, as I said earlier, of the Money Guidance Service here at GamCare. So Kathy, do you want to share your slides, and off you go.
Thanks, Anna. Thank you. Okay. Hopefully everyone can see that. It's me. Just gonna do it. So the screen. Hopefully everyone can see that. Yeah, so hi everyone. As Anna said, I'm the Money Guidance Service Manager here at GamCare. It's a relatively new service that we've been developing over the last sort of 6 months, year or so, and we're officially launching this week. So just want to tell you a little bit about the service, but also just some insights into what we're hearing, the issues which actually do really reflect what a lot of what Kate just said that they found in the survey. A little bit about the what we found, how the service works, how people can access it, and some of the sort of successes that we've had from the project so far as well. So just to start off, just to give a little bit of kind of background into why the Money Guidance Service came around and just how gambling related harm really impacts on people. So obviously it can impact financially, and that's what we're looking at mainly today from the Money Guidance Service's point of view, but also it can really impact on people around education and employment, relationships and health. So, you know, lots of different impacts can impact people in many different ways. Just want to share some data here from our annual report from 21-22. And these were just findings that we got from the gambling helpline, which really sort of fed into GamCare recognising the need for the Money Guidance Service, which is why it came about. So back then, 30% of the helpline and treatment users reported that their gambling was due to financial difficulties. 75% of them said that they struggled with financial difficulties. Of those, 57% of gamblers who contacted the helpline back in 21-22 reported having debt, and 46% of affected others also said that they have financial difficulties. And I will tell you a little bit more about how the service works, but the Money Guidance Service is open to gamblers and affected others as well, so we do help everybody. Just wanted to share some insights from the helpline, just things that we sort of hearing through callers on the helpline. So, and again, really ties in with what Kate's just said from the findings from the survey. So lots of gamblers seeing callers seeing gambling as the only way out financially. And the worrying thing is, even when they realise that gambling is a problem for them, they still might see gambling as a solution, so they're still gambling. They know it is harmful for them. We'll also see callers saying that gambling is a way out of poor housing. So the helpline advisors have said that they speak to clients who perhaps living in unsafe areas. There could be high crime rates. They might be feeling in danger themselves, and so they're gambling because they see that as the only way of getting out of those poor housing conditions. Could be issues around poor disrepair, that kind of thing as well, and really seeing that as the solution to get better housing. The other thing is we've seen a lot more people with issues around safeguarding as well. So speaking to lots of clients, and we're already seeing this in the clients we're seeing through the Money Guidance Service as well. People having no access to heating. So speaking to people where they might have 2 or 3 weeks before they're going to get payday or their next pay for their benefits. In their emergency electricity. So we recently spoke to a client on the Money Guidance Service who had just a few pounds left in their emergency electricity on the meter, and it was 3 weeks before they were going to get their next pay, and like no food either. It is people being affected who are receiving benefits as well as working. So it's just generally affecting everyone. The other thing with the safeguarding is, well, unfortunately, we do speak to quite a number of clients who are at risk of self-harm or have considered or attempted suicide. So that's why it's just kind of highlight the point of people really needing to reach out and get that help as soon as possible, just to sort of get the support that they need. Just got a couple of quotes here from one gambler, an expert by experience, and an affected other. Going to read through. So first of all, Ben, who's an expert by experience, said, on my gambling, I used an overdraft, loans, I remortgaged, I took mortgage holidays, I used PayPal credit cards and credit balance transfers. And I sought help. I had 21 creditors on my credit report, including utility providers I owed money, including utility providers I owed money to for the bills that I hadn't paid because I'd gambled. It's kind of demonstration of, like, example of the kind of extent that people, the financial difficulties that people get into and the debt problems that they have. Also a quote there from an affected other who said, my husband was completely out of touch with the reality of his financial situation. It took us 6 months to piece together a picture of who he owed money to. We borrowed from family and friends and used savings to pay off my husband's gambling debts. And quite often we speak to affected others who just had no idea at all about the sort of extent of the gambling, the extent of financial difficulties. And one of the things that we can do through the Money Guidance Service is really to support the affected other and the gambler to kind of unpick those things and just get some clarity on what their financial situation is, just helping them thinking about prioritising. The Money Guidance Service isn't about telling people what to do with their money. It's really just about getting them to sort of identify what the issues are, putting together a budget and just getting some clarity on what their financial situation is. And I'll talk a little bit more about what we found already in just a minute. So just talking about the Money Guidance Service, what it's about, how it works. So we provide money guidance to people who are existing GamCare clients, so people can access it through either the helpline or the treatment teams. When we talk about existing GamCare clients, they don't need to have been engaging with us for a certain amount of time. So if you've got someone who would benefit from getting help from the Money Guidance Service, they can literally just call the helpline and say, I would like to be referred to the Money Guidance Service, and they'll ask a few questions just to make sure they're suitable, and then they'll pass them over. So we talk about existing GamCare clients in a very loose sense. They don't need to have been engaging with the service for a certain time or anything. As I said, it is available to both gamblers and affected others. One of the really unique parts of the service, I think, is that we're part of the treatment team. So we can work really closely with the treatment practitioners. So if a client has been referred into the treatment team and the Money Guidance Service, with the client's permission, we can really work closely to provide a holistic service. So I've sort of worked in money guidance and debt for many years. And in the past, it's always been a case of signposting and referring people to external services. You know, you might have some engagement, but it's really unique that we've got that very, very close engagement with the treatment teams with the client's permission. So we can really make sure that they're, you know, we're working together to get the clients to make the changes that they want and need to be making. Yeah, so and also the Money Guidance Service is specifically related to gambling harm. So again, that's sort of like the unique, the USP, I suppose, of the Money Guidance Service at GamCare, is that we do look specifically at gambling harm. Just thinking about how it works. So the service is broken down into 3 different pathways. Pathway 1 is where we provide basic money guidance by the treatment and helpline teams. And part of the project involves, we've got a training and development lead who's providing training to all the helpline and all the treatment practitioners and all the helpline advisors so that they can give basic money guidance. We've also just launched our Money Guidance Service Toolkit. So there's an online toolkit on our website, and part of that pathway 1 will be for the helpline advisors and the treatment practitioners to sort of guide people and signpost them to relevant pieces within the toolkit as well. But it is available to anybody to access online themselves too. Pathway 2 is the sort of more tailored approach. So we offer up to 3 sessions with one of our money guidance practitioners to really kind of provide that tailored service to the gamblers or affected others. So we'll do things like looking at the budget sheet with them, looking at how they might want to be reducing certain expenses, perhaps looking at how they can protect available income as well. So really just generally looking at their budget and their spending and the things that are important to them. So it's very much tailored around what their needs are, what their priorities are as well as us highlighting things for them to think about. The whole service has been developed with lived experienced involvement. So we've had a few sessions with a lived experience focus group. So we really kind of listening to what people with lived experience need. And again, the lived experience focus group was made up of both gamblers and affected others. And then pathway 3 is where we would signpost people. So it is a money guidance service. We don't provide, we're not authorised to give debt advice. So we've got referral pathways with pay plan and through the money and pension service network. So if people need debt advice, we'll refer or signpost them through to that. We also work really closely with our gambling related financial harm project. So sort of involved in meetings and the sort of networking events that they do. So we work really, really closely with them too. Just a very brief overview about what happens if somebody's the money guidance service journey. So how somebody accesses the service. So they would call the helpline or speak to the treatment teams if they've gone direct to them. A referral would be made through to the money guidance service. We would contact the client within 5 working days. And then we would arrange an appointment with a practitioner. At the moment, we're able to offer appointments within 2 weeks, and we're actually contacting clients within a couple of days, but the maximum they would need to wait would be 5 days for us to make that initial contact. And then we would work through that budget, look at their finances, and then we agree what actions to take. And we have those free follow-up sessions with them. They'll have free sessions with the advisor. If we found that somebody was particularly vulnerable and they would really benefit from an additional service, we won't just say, sorry, you've had your free goes and send them away. We will have an additional one. But the plan is to sort of tie everything up within 3 sessions. Just a list there of how money guidance can help for the gambler and the affected others. So it's really about helping them to re-establish control of their financial situation, address financial issues, and really get them to understand their finances. I'll talk in a minute about some of the findings, but we're already seeing people who perhaps think they've got more of a disposable income than they really have, but they're not thinking about things they should be paying, or perhaps they might think that they haven't got as much available as they really have. So really getting them to kind of break it down and have it all written down. Establishing boundaries, about helping them to take responsibility, thinking about what are their spending habits, what are the triggers, like what things are, what are the danger points, what are the trigger points for them to be gambling, and then just really helping them to kind of put routines and barriers in place, just put those things in place to help them take control of their finances. For affected others, some of those are similar as gamblers, but also it may be around helping them to extract their finances from the gamblers. So we may talk to them about like separating their finances, getting separate accounts, who's going to be responsible for paying what, establishing those boundaries, sort of helping them to access some of the tools, and also supporting them to support the gambler with the recovery as well. So just sharing some insights that we found from the money guidance service. So first of all, these are the sort of issues that we're finding the people who are engaging with the service so far have had. So a large number of them, as I said earlier, at risk of self-disconnection for their gas and electricity. So yeah, having no money to top up the money, to top up their prepayment meters. Clients having no money for food. And no food, like no access to food at home either. So we're needing to issue food bank vouchers. And as I said before, some of them might have 2 or 3 weeks before the next payday. So yeah, and that's, I think, would lead them to needing to borrow from friends and family. Gamblers and partners holding down more than one job, but still not managing financially. So, what are the ways that we look at maximising people's income, increasing incomes? We do a benefit check, that kind of thing. And a suggestion may be for them to think about getting another job. There's the sort of normal things we would do to maximise income, but we're speaking to people who already got other jobs and they're still struggling. many clients are having to top up their rent when they're receiving benefits. And I think a lot of that is a result of private rents becoming higher. So mortgage interest rates are increasing, which means particularly in private rented accommodation, landlords are having to increase the rent. And so then people are finding that they're needing to top up more for their rent, even when they're receiving benefits. Clients feeling like they'll never be able to get on the property ladder as well. And again, that could cause them to relapse because they may think that that's the only way out. You know, that they have that big win that might enable them to get a deposit so that they can start, start their journey on the property ladder with buying somewhere. And then also just clients who perhaps are in danger of relapsing, where they might have a broken washing machine or a cooker, those kind of essential things that they need, but they might be just over the limit to qualify for a grant or other financial support. So as part of the money guidance service, if somebody needed something like that, we would sort of give them the information of advice and support them with making grant applications, but they might just be over the limit to do that. And again, that could be a real danger for them in terms of relapsing. Some of the positive outcomes that we found from the service, we found that people are already feeling more motivated to sign up for gambling blocks. So we've had a few clients where they may have been told about gambling blocks, for example, on the helpline before, but they might not have been motivated to do it. But when we've started going through their budget with them, we've had a couple of clients say they can actually see a way out. They can see how putting the gambling blocks in place would really, it could help them, it will support them, and they can start seeing a light at the end of the tunnel and some solutions. Clients really getting a clearer picture of their finances when they've completed the budget and thinking about where they can save money, where they might be able to reduce expenses, but also thinking about how they can protect available income. So, we talk to them about how they might be able to do that, how to keep their money safe from any risk of gambling. We've also found that gamblers tend to disclose the full extent of their gambling, where they might not have in the past. So we've spoken to a few clients who may have perhaps sought debt advice before, and it may have looked on paper as if their debts were affordable, but we've discovered that it's because they didn't disclose the full extent of their gambling spend, and when we've spoken to them, we've realised that they were actually spending a lot more than they told the debt advisor, so it looked as if it was affordable. Well, actually it wasn't. And also clients able to prioritise the thing that they spend their money on so that they can really think about what they're valuing with it and help with their recovery. So we found clients have sort of, been looking at what they're spending their money on and really helping them to think about what things do they need to be doing to help with their recovery, what are the things that are good for them, what are the things that are supporting them in their recovery journey, and then helping them to prioritise. And also perhaps showing them that some money can be available to do different activities that can sort of, distract them from the gambling and help them with their recovery as well. Just doing things that help make them feel good and feel nice. Just in terms of how to access the service, so people can either call the National Gambling Helpline, the number's there, or they can speak to their GamCare treatment team practitioner if they've got one. So they've accessed our services direct through the treatment teams. Just speak to the helpline or the treatment practitioner, say that they would like to get an appointment with the money guidance service, and as I said, they'll just be asked a few questions just to assess that they are appropriate to be referred through to us, and then that referral will be made and we'll give them a call within a couple of days, a maximum of 5 working days. People can also access our online toolkit now, which is available on our website, so anybody can use that and access that. The toolkit consists of 5 fact sheets, so we spent quite a lot of time thinking about what topics we wanted to include in that. And as I said, the unique, the sort of USP for our toolkit, as opposed to others that are out there, is it's very, very specific around gambling harm and financial gambling harm. So we've got one that looks at tracking your spending, one's around taking control of your gambling spend, We've got one that's called generating additional income. We would traditionally call that maximising income, but we had feedback from our lived experience group to say that that could be a trigger. So we renamed it so that it didn't cause a trigger to them. Then looking at priority expenses, managing household expenses. And within those fact sheets, there's some information about where people might be able to get some help towards that fact sheet. So like useful information, controlling your credit rating, getting debt advice and support, and protecting your loved ones. And then there's also one there for the affected others, so family and friends, and around keeping your finances safe. So that's everything I had to say. Hopefully that's been useful for you. But yeah, happy to take any questions if you want to pop any in the Q&A. And there's my contact details if you want to contact me after as well. So I'll stop sharing.
That's great. Thanks very much for that, Kathy. Hugely insightful in terms of what you're seeing within the service. Okay, so we're going to come on to the Q&A session now and a bit of a discussion between us. We've had a couple of questions, but do continue to post them in the Q&A tab at the bottom of your screen if you have any. I thought now might be a good time to bring you in, Helen, because obviously you're hearing callers day in, day out on the helpline. And Kathy has outlined some of the kinds of things we're seeing. I thought it was interesting as well from Kate's presentation that how, I mean, I guess it's logical in a sense that financial harms escalate as gambling escalates. And it's not just the financial harms themselves, but the impact that has on people's well-being and their families and so on. So I'm interested in whether the presentations chime with what you're seeing and hearing on the helpline, and what's your response to them?
Thank you, Anna. Yeah, very much so. I think that the themes are all very much connected, and I think something which is particularly apparent when we think about the helpline, we think of it as a gateway service. So, you know, it's that sort of front door to access and support, which means that we have conversations with people at every point, and this includes people. When we say that people see gambling as a means of a solution, whether it's because it's a housing thing, whether it's because they're worried about job insecurity, what that translates to on the helpline is this sort of ambiguity in terms of stopping gambling, because gambling may then become a solution, and that then when we think about building a recovery, we sort of think about these key steps. So like step one would be someone recognizing that they have a gambling problem, or perhaps their gambling is problematic. And then the next step, you would think the next step would be telephoning us, and that would be like, you know, step one. But really, it's actually, as Kathy noted, it's that next bit of taking action, and actually recognizing that you can have all of the support available, but whether or not a person is ready to take those steps available to them or not is very much going to be dependent on their ability to see a way forward. And when we're thinking of callers are coming through and talking to us about the cost of living, and as Kate had pointed out, you have these big disparities. So you've got people that maybe are on low income, that are on benefits, where there's a lot of insecurity, and their money is just not making it to the end of the month. So therefore gambling, you know, to them is possibly a way of sort of making it through. But we're also seeing people that own businesses, that are self-employed, that have got this insecurity of when are these invoices going to be paid, and are going from having zero in the bank to suddenly having, you know, several $100,000 depending on when an invoice is coming in. And that's really frightening for people that are then thinking, I've got to pay for my employees, I've got to pay their salaries, and there's that bigger there's that much bigger picture to it as well. So what the cost of living is doing is sort of, if you think of it, it's kind of like turning up the pressure. It's like a pressure cooker situation, and it's also, well, it's creating for people is this thought process of there is less. If we think of people that perhaps gamble as a hobby, or they perceived it as gambling for fun, gambling with money that was not attached. So these are people that understand budgeting. These are people that know this pocket of money is for my mortgage. I would never touch that. It's my mortgage money. What we're seeing is that free money, that fun money, is getting smaller and smaller and smaller, and people aren't necessarily recognizing that. They're not necessarily thinking, well, my food bill in Asda just jumped up by £100, so that means means I need to reduce the amount I gamble with by £100. And what we're seeing is that people aren't doing that. And then what makes people particularly vulnerable in these circumstances is their habitual behaviour. So when we think about food insecurity, so you have the types of people, say, that like to do a monthly food shop, and then you have the types of people that like to do a weekly food shop, or and those people correlate with what Kate has said, you know, so the unmarried people, the younger people that, you know, are just, you know, you're feeding yourself. But it's actually those people that have done a monthly shop, that are in a routine of doing a monthly shop, that have a freezer full of food, that have a buffer in terms of when they suddenly realise they've gambled all of their money and they now can't pay for something unexpected, but they have this freezer full of food that will get them through. Those are still people that are experiencing food insecurity, but they don't necessarily recognize that they are people that are experiencing food insecurity, because they're like, well, I know I've got food, I was able to, you know. But then we have people that say, oh, I'm living on spaghetti and oil. That was something I heard last week. You know, I'm just eating spaghetti and oil, or I'm really fed up of, I had one person the week before to say to me, I'm really fed up of living on beans on toast, but I've got food, so I don't need a food bank. So it's those thought processes which the impact of the cost of living is just making those, it's just, you know, making that a little bit more pressurized and making it a little bit harder. So I think that's maybe a few more personal insights in terms of what we're seeing.
Yeah, absolutely. And I think what you're talking about really characterises the sort of ambivalence people feel for a period when they're wrestling with the idea that something is becoming or has become problematic. It takes time really for that to be, you know, and people have days where they're very committed to taking action and days when they feel less committed. And I guess what we're doing is trying to help them in the direction of taking action when needed. It's really interesting. Thank you. And Kate, you have done lots of research around the cost of living. It must be a huge theme for you at YouGov at the moment. So I'm just really interested in whether the findings of this research around gambling and cost of living is sort of similar to other research that you've been involved with.
Yeah, so I think it's a very good question. And I think in terms of the other research that we've done on gambling, it's definitely kind of marrying up. So it's the same groups that we're seeing consistently who are kind of most affected. And we kind of tend to see there's quite stark differences by PHSI. But I think something that's quite interesting when we think about gambling behaviour versus kind of other research that we've done more generally, so kind of speaking to colleagues in other teams, is in the cost of living, lots of people have kind of cut back on what they see to be non-essential spending. So kind of linking quite well what Helen just said, but people kind of tend to get rid of things like hobbies and entertainment first to make sure that they can cover their essentials and cover their bills. But in the case of gambling, people kind of see that as their hobby and a form of entertainment, but it's kind of tied up with addiction. Is obviously an addictive behaviour, so it's not something that people can kind of just stop doing in the same way. So I guess in that sense, the rising cost of kind of everything else create a bigger pinch because they haven't then cut back on their gambling necessarily. So actually that money is kind of coming out of other pots. And so yeah, I guess they kind of experience this kind of financially difficult time in quite a different way.
Yeah, it's really interesting that it sounds like you're describing a sort of reluctance around behaviour change, whilst not necessarily recognising the habitual or addictive nature of some of the products that might be involved. And that's risky really for people, isn't it? They're taking, you know, significant risks with their finances and of course their well-being. They're so entwined, aren't they, people's financial well-being and their overall well-being.
I think it's also that sense of people thinking that it could improve their financial situation. So yeah, we saw that 2 in 5 of our 8+ gambling group think that gambling will improve their situation over the course of the next year. And we know from kind of all the research we've done, speaking to kind of people gambling at these rates, that isn't necessarily the case. People kind of lose all of their money before they seek help. In some cases, people can't pay essential bills, can't pay their mortgages, but there is still that sense that people might win big. So yeah, I think it just kind of really reaffirms that need for messaging around the instability of gambling as a source of income, and in particular when you get to a point where you're gambling quite large amounts of money. It's kind of gone from being something that you might see as fun to something that's kind of a bit more dangerous and has those risks associated with it.
Yeah, and I know it's absolutely a theme of all the kind of outreach and education that we do, that gambling is not a way to make money and should not be seen as such. But you know, but obviously in difficult situations, people are sometimes prepared to take greater risks, I guess, which is a worry. We've had a question which is interesting. I don't know if we've seen anything like this, but the question's around the cost of living government grants being rejected for people who show gambling activity on their bank statements and needing to provide 3 months worth of gambling-free statements in order to access those grants. And the question is around whether this could be perceived as prejudicial, given that other behaviours, other addictive behaviours particularly, don't show on your bank statements in the same way. Maybe Kathy or Helen, have you seen any or heard of anything like this?
We've certainly heard of benefit. So the government tracking people calling very upset because their benefits are being reviewed, but not in the sense that we would think them as being as in reviewed as in like an application for entitlement, but being reviewed because gambling has been picked up and is being seen as a form of income. So if a person, say, has won a significant amount of money, they are obligated to inform the benefit office that they've won it, because it's seen as income, and then their universal credit is reduced as a consequence of this. But when we see with gamblers, in that the money comes in and then the money immediately goes back out again. But it is this perception that we've certainly seen more of that coming through, of people being very, very anxious that they are being reviewed and that they are unable to access things like with universal credit, where a person can have an advance, then they're not being able to access that advance whilst they're being investigated for their gambling related behaviours. So yeah, it's certainly something where there is a different, I think perhaps the best way of describing it is there is a different tone. There is a different tone of conversation around gambling and misappropriation of money. It's being viewed in a slightly different way, perhaps more proactively. And we could then reflect disproportionately to perhaps other types of addictions, which are perhaps more hidden and less transparent.
Yeah, and it's interesting that this is one of the few ways gambling is quite visible. In many other respects, it's a very invisible issue for people sometimes, because it doesn't have the same signs as obviously alcohol or drug use. Just very briefly, Kathy, I know that we've had a few banks and financial services join this webinar, and banks have a unique view of people's gambling behaviour because many gamblers will have numerous accounts. How can banks get people to help quickly and effectively? What can they do?
Yeah, thanks, Anna. I think it's around, and this is a piece of work that we've done quite a lot on when I've been working closely with the Gambling Related Financial Harms Project as well, just sort of raising that awareness. I think it's about if any of the banks sort of recognise repeated gambling, you know, like what could be potentially problem gambling, is having that conversation with the customer and then directing them, you know, suggesting that they do contact the National Gambling Helpline, and then they can get access through the Money Guidance Service. But I think it is really just about letting them know what support's available, and just making it clear, as Helen said, and as I said, we know we're not about telling people what to do. We're just about letting them know what support's there, and just letting them know what help's available. So I think it's just about trying to pick up on it as soon as possible and just encouraging them to get that support as early as they can.
Yeah, okay, brilliant, thank you. Okay, well, we're drawing to a close now. It's almost 12 o'clock. So first of all, I'd really like to thank Kate and Kathy and Helen for joining us. You've been hugely insightful. Thank you for making the time. We will circulate the slides from today and make the recording available to people. If you do have any further questions, you can get in touch on the email address webinar@gamcare.org.uk, and we will definitely come back to you. But thanks very much for joining. Thanks, guys, on the panel, and we'll see you again soon.
Thanks, everyone.
Thanks for coming.
Everyone, bye.